Hello everyone! In this video, we will discuss about facial bones in detail. Altogether, there are 14 facial bones. Most of them are paired except for two. The facial bones are nasal bones, maxillae, zygomatic bones, mandible, lacrimal bones, palatine bones, inferior nasal conchea, and the vomer. So the first bone is nasal bones, which is paired and meet at the midline and forms a bridge of the nose. Rest part of the nose is made up of cartilage. Next bone is maxilla, which is also paired. Both bones unite to form the upper jawbone. Maxillae articulate with all the other facial bones except mandible. It contributes to form part of the orbital floor, parts of the lateral walls and floors of the nasal cavity and most of the hard palate. Hard palate is the bony roof of the mouth which is made up of the palatine processes of the maxillae and horizontal plates of the palatine bones. It separates the nasal and oral cavity. Maxillary sinus are located in each maxillae which drains into the nasal cavity. Alveoli, also known as sockets, contains maxillary teeth or the upper teeth which are situated in an arc of the alveolar process of the maxilla. Anterior 3/4 part of the hard palate is formed by the horizontal projection of the maxilla called as the palatine process. Basically, the maxillary bones unite and fuse prior to the birth. The infraorbital nerve and blood vessels along with a branch of the maxillary division of trigeminal nerve passes through the infraorbital foramen and opening in the maxilla inferior to the orbit. Incisive foramen lies just posterior to the incisor teeth, allows the passage to the branches of the greater palatine blood vessels and nasopalatine nerve. Inferior orbital fissure is a part which is located between sphenoid bone's greater wings and the maxilla. The next bone is zygomatic bone, which is also paired and popularly known as cheek bones, as they form the prominent parts of the cheeks. It participates in the formation of the lateral wall and floor of each orbit. It articulates with frontal, sphenoid, temporal and maxillary bones. Zygomatic arc is formed by the articulation of the temporal process of the zygomatic bone projecting posteriorly and the zygomatic process of the temporal bone. The next bone is mandible, also known as lower jawbone. It is largest of all the facial bones and the only movable bone of the skull. In the lateral position, body, which is curved and horizontal portion, along with two perpendicular portions, that is rami, in singular it is called ramus, are present. The point of the mandible where each ramus meets the body is known as the angle. In each ramus, posterior condylar process is located which articulates with the mandibular fossa and articular tubercle of the temporal bone and thereby forms the temporomandibular joint. The temporalis muscle is attached to the anterior coronoid process located in both ramus. Depression found between coronoid and condylar processes is known as mandibular notch. An arch called as alveolar process contains the alveoli or sockets for the mandibular teeth or lower teeth. Inferior to the second premolar tooth lies the mental foramen, which helps to anesthetize mental nerve by dentists during various procedures. Most of the time, anesthesia is provided through the other foramen known as mandibular foramen, which is located on the medial surface of each ramus. From this foramen, mandibular canal originates, which runs obliquely in the ramus and anteriorly to the body. This canal allows the passage of the inferior alveolar nerves and blood vessels supplying the mandibular teeth. Next, lacrimal bones. These are also 2 in number. They are thin and similar to the fingernail in size and appearance. It is the smallest bone of all the facial bones, lies to the posterior and lateral to the nasal bones and form a part of the medial wall of each orbit. A vertical groove formed with the maxilla called lacrimal fossa in the lacrimal bones contains a structure which collects tears and passes them into the nasal cavity in the lacrimal sac. Next one is palatine bones. They are also paired and L-shaped in structure. It forms posterior part of the hard palate along with the part of the floor and lateral walls of the nasal cavity and a small portion of the floors of the orbits. Posterior part of the hard palate is made up of horizontal plates of the palatine bones. The next bone is inferior nasal conchea, which is present on both sides. It lies inferior to the middle nasal conchea of the ethmoid bone, but these are separate bones and are thus not a part of the ethmoid bone. These scroll-shaped bones forms a part of the inferior lateral wall of the nasal cavity and projects into the nasal cavity. All 3 pairs of the nasal conchea, that is superior, middle and the inferior, helps to increase the surface area of the nasal cavity and facilitates filtering of the air prior to its entrance into the lungs. The next bone is vomer, which is single and resembles roughly triangular in shape, located on the floor of the nasal cavity. It articulates superiorly with the perpendicular plate of the ethmoid bone and inferiorly with both the maxillary bones and the palatine bones along the midline. It participates in the formation of the inferior part of the nasal septum.